Welcome back, guys, for part 2 of diving into the basics of ECG understanding for cardiac CT specifically. All right, in the last video, we covered the rough idea of the PQRST wave. Again, P, Q, R, S, and T. R being the most important, T being the second most important. Now, we also said that we want quality tagging of our R waves, and that starts by proper ECG placement and using proper ECG pads, of which I prefer to use wet gel pads over the dry pads. However, today, we want to understand just a little bit more of the idea of the differences between percentage and millisecond. So as we mentioned before, percentage scanning, it always starts at 0% and goes through 100%. From R wave to R wave. So from R to R, we have a 0%, and it goes up to 100%, then it's retag 0% up to 100%, and so on. However, in millisecond scanning, it is different. In millisecond terms, remember it starts at 0 milliseconds and then goes up to a number determined by the heartbeat. Let's for today just say that this is going to go up to 600 milliseconds for this beat. Now we can see this beat's a longer beat in time. Notice percentage doesn't change no matter how close or how far apart the beats are. In percentage, it's always 0 to 100. But in time, it is a different factor. So this one could be 0 milliseconds up to 1,000 milliseconds. Again, depending on heart rate. Milliseconds. Same thing, this is now going to be a shorter beat, this is going to be a longer beat. I do believe, and there are some things coming I have seen that are coming where they're trying to work to an ECG-less scanner. However, we're still going to have thousands and thousands of scanners out there that are going to require ECG editing and tagging for years. So it's best that you learn this. All right, so here we have all this. Well, here's the difference, and this is something you really have to understand. Generally speaking, and I'm going to draw a crude wave here, and really crude, that'll be my T. So this is going to be my R wave up here, and this is going to be my T wave. In time and space, generally from your R wave to your T wave, so from your R to your T, in time, excuse me for bumping my camera, I'm high-tech here, high-tech. In time frame, here to here, could be, we're going to say this is 300 milliseconds. I don't really know because we don't know the person's heart rate. However, in time and space, the R to the next T, they all stay equal in time. That really matters. And why does that matter? Well, it matters because that means we have a solid place in the ECG rhythm that will be the same in time on every single beat. Now this will change from patient to patient, but your patient, even if he varies in heart rates, and let's say they varied from 50 to, or excuse me, they went from 80 to 50 to 40 to whatever the heart rates are going to be here, okay? That probably isn't accurate since my 50 is longer than my 40, but you get the idea. Let's make that quicker than my 50. So let's just make that like a 60. And then this is really long. We're going to say that's a 30. So we got a bouncing heart rate here. And so no matter where it's bouncing, this R to the T wave stays stationary in time. That's huge to know. Now your time difference changes from the T wave to the end R wave. This is where time changes. This is why you do not really want a millisecond scan over in the diastolic area, because depending on a heartbeat, if let's say I set a window for radiation to be around 700 milliseconds, I wouldn't have even caught it in this one. And in this one, it would have been way early. So just know for this video that from your R to the T wave, it is relatively stationary in time from beat to beat to beat. And this matters when we're setting up our physics for our scanning, especially for not only CTA scanning, but also for structural anatomy as well. Because for certain structures, we need to be in certain different phases of the cardiac cycle. So for this video, recap. R wave, super important. Make sure your tags are on. Know that your T wave is second most important wave. The reason why is because our R to our T is stationary in time. Time changes from the T to the next R. This will matter when we start setting up protocols and determining where we're going to place radiation. All right, guys, until next time, and we start diving in even deeper. Hope you have a great day, and hopefully this is making a little bit of sense.